We provide high quality care for everyone, independent from what their insurance status is. Many people who otherwise would not have access to care.
Well, an end to Affordable Care Act tax credits could leave more Marylanders uninsured, which means health leaders worry that it could overwhelm community providers like Chase Brexton. Hello everyone, I'm Jason Newton. Welcome to 11 TV Hill. It has been more than 2 weeks since the federal government closed, and there seems to be very little room for compromise. A federal judge blocked the White House from firing federal workers during the shutdown. Now, Maryland Congressman John Olszewski wants Congress to codify this ruling into law.
While we welcome the ruling and the temporary stop here, this is still something of deep concern in terms of how this administration is treating the federal workforce. It's a very straightforward bill. It's less than one page and just says that firings are not permissible under any circumstances during a federal shutdown.
Although the bill has more than 70 co-sponsors, all are Democratic members of Congress. Now, health care is at the root of this stalemate. Our lead political reporter, Kate Amara, explains what these tax credits mean and their impact here.
This is where the real-world impact of Washington's dysfunction becomes crystal clear.
Federal and state Democratic lawmakers came to Chase Brexton and Glen Burnie today to call for an end to the health care fight in Washington that is fueling the government shutdown standoff. The two parties in Congress currently deadlocked over affordable health care tax credits. Democrats want an extension before enrollment begins on November 1st and warn if it doesn't happen, everyone will pay. Premiums will nearly double for most, including 190,000 Marylanders.
95% increase for those folks who would just benefit from the federal subsidies we're discussing right now.
Many will become uninsured, leaders warn, overwhelming emergency rooms and community health care providers like Chase Brexton.
Whatever the number is, we're going to work to be ready.
Most Americans say they want the tax credits to continue, according to research from the nonprofit, nonpartisan firm KFF, including 59% of Republicans and 57% of MAGA supporters who say Congress should extend the subsidies. In addition, nearly 78% of people enrolled in the ACA marketplace live in red states won by President Donald Trump in 2024. Even so, Republicans in Congress say the pandemic-era subsidies are no longer needed and way too expensive.
People tend to react when the thing kicks in, when they lose their health care or they can't afford their health care. I'm trying to prevent that from happening.
For 11 TV Hill, I'm Kate Amara.
Kate, thank you. Right now, we're at the start of open enrollment for Medicare. Three main providers, Humana, Aetna, and United Healthcare. They're switching up some of their coverage plans here in Maryland, which means more people may be rethinking their insurance. And then there's the general open enrollment. That begins next month. Joining us now is Michelle Eberly. She is from Maryland Health Benefit Exchange. Thanks for coming by.
Thanks for having me, Jason.
Certainly. Watching this piece, this is going to be a little confusing for everybody, it seems like right now. What's not confusing, the start date is the start date.
That is correct. We are open enrollment begins November 1st. Okay. We are ready to go, and we have our Maryland Health Connection today. You can go in and look around and see what plans are there, what the new price reflects, the new premiums will be, and prepare yourself to really shop for what's best for you and your family.
You said the key word there, premiums. That's been a part of this whole thing that's been going on in D.C. Can premiums end up changing for folks, what they see right now versus what they may see once the shutdown is over?
Yes, premiums will be changing.
Yeah.
And so in Maryland, we have done a tremendous job over the last 10 years of really bringing affordable health coverage to Marylanders. We've done that through a state reinsurance program. And in fact, we have still have the lowest bronze and gold health plans in the nation. So our premiums nationally are low. However, when H.R. 1 was passed this summer on July 4th, it did not include an extension to tax credits and enhanced tax credits that are set to expire at the end of this year. Unfortunately, the way insurance works, you have to load, you have to have those rates approved. Insurance carriers submit them, they get approved. We get them into the system. We run renewals for consumers, and they get their notices in the month of October, so that come November 1st, they are prepared and ready to change their plan, make modifications, whatever they want to do. Sure. because we don't want any loss or gap in enrollment for coverage for 1/1. So those notices have had to go out, and right now we don't have an extension of the tax credits, which means on average folks that are utilizing tax credits may see up to a 35% increase in their premiums. Now that's good news because Maryland, working with our General Assembly, had the foresight to put in a program that would allow us to shore up some of that loss. Otherwise, on average, it would have been a 95% increase in premiums. So we have helped, but it's not sustainable. So our message this year is Maryland Health Connection is here. We're here to help. Prices are going up. We want to have you shop around, look, see what's available, and really recognize that some people have to make hard decisions about whether they can continue to afford their health care or not. But we're here to help every step of the way in helping you make those decisions.
If I remember right from the ACA, part of it relies on young, healthy people joining in the market to help keep premiums down. But if they have this sticker shock and they say, this is how much healthcare is there fear that some of these people won't join into the market?
Sure, and this is where it affects everyone.
Okay.
Because when you look at how insurance premiums in the individual market are set, they look at the whole pool of people. And so if you have a good mix, and our mix is about 36% under age 34, which is really good, then they're lower utilizers. So it offsets the cost of higher utilizers. But if those lower utilizers say, you know, I just can no longer afford this, it's my groceries or my rent or health care, and I'm relatively healthy, then it leaves a mix of higher utilizers, which now that cost has to get spread among less people.
We were talking off camera a little bit about other states have looked at saying to the insurers, listen, just give me 2 rates. Let me know what the rate is if things work well in Congress on time, and give me another rate if not. And I'm guessing Maryland, like you said, Maryland luckily was creative.
We were, and we ran through so many iterations and asked our carriers to submit multiple rates of how we could retain the most people and how we could use the reinsurance program funding that I spoke of to really help people not have to bear a brunt of loss of those tax credits. But we can't help everyone. There just isn't enough funding to do that. And if Congress does act between now and the end of the year, we will fortunately be able to reinstate those tax credits. It may take additional work and time. We don't know what that will look like at this moment, but we will do whatever we have to do with Maryland Insurance Administration, our carriers, with our staff to make sure that we are providing access to the most affordable health coverage for Marylanders.
Okay, outside of the red tape and things, once people get into the website and start selecting, it'll look just like it has before, and they'll go through the same process, right?
Absolutely.
Okay, let's reassure some folks if they do have questions. You have a phone number folks can call, and I'm sure there are people available to walk them through before they have to sign on the dotted line, correct?
We have Maryland Health Connection is our website. We have mobile app. We have our regular website. We have our navigators that are available. We have our call center available, and I don't know if you have that number handy.
No, we'll put it up after the show, sure.
Okay, good. And our brokers, our licensed authorized brokers. So we have a lot of help throughout the state, and we really are encouraging people, please come call us, visit us, let us help you this year. It's going to be very confusing. We don't know what action Congress will take, and so we'll help communicate through that confusion and help people stay covered.